This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
When COVID-19 hit, hospitals jumped into action. They formed COVID teams and special COVID treatment facilities. They are still prepared for COVID patients, but they're just as ready to treat other illnesses and injuries, and that is the message behind Safe, Ready, Waiting. Joining us this afternoon, we'd like to welcome back to Delmarva Life PRMC President and CEO Steve Leonard.
How you doing?
And along with Steve, President and CEO of Atlanta General Hospital, Michael Franklin.
Good to be here. Thank you.
Michael, let me ask you, Safe, Ready, Waiting. What does that mean?
It means that hospitals are doing everything that we can to make sure we're following guidelines to protect both the workers at the hospital, as well as making sure that we're protecting any patients or people who come to the hospital seeking care or seeking information about appropriate healthcare services. So we're following proper guidelines. We're educating our staff and our work teams, and we're making sure that we're providing the community with access to the necessary care that they might need.
So, Michael, this is a collaborative effort.
Yes, this is a collaborative effort because it's about the community. It's about making sure that providing the access to healthcare needs that our community really they've come to expect. Living in our area, they've come to expect easy access to healthcare services, and we need to make sure that continues.
Mr. Leonard, would you say this also applies to the general practitioner offices as well?
Absolutely. I think what we're trying to get out there is a message that it's really important that you have your healthcare needs met, both those that might be emergencies, joining you to an emergency department or the hospital, as Mike mentioned, as well as really having important constructive relationships with your primary care doctor. So I know both the systems have been focusing on making sure that's a safe experience as well. It's important that people, I'll say, re-engage with their healthcare provider in the office so that we can make sure we keep them healthy and well and out of the hospital if at all possible. And that environment is just as safe. Hospital physician office staffs are taking all the appropriate precautions, and it really is safe for people to come and see their doctor to have their chronic illnesses addressed and go forward.
So explain to me again what kind of precautions the hospitals are taking to ensure that safety.
We still continue to make sure our teams are safe. We screen folks, employees, providing all the necessary personal protective equipment, as well as when people come to the hospital, we have algorithms to make sure that we're, even for elective surgeries, that we're screening folks, checking for symptoms, giving them a call in advance. Should they have any concerning signs or symptoms, we have them follow up with their doctor and receive testing, if necessary, including COVID testing. And if they happen to be positive, a small chance, we would defer those types of procedures until that they are ready to have them. And then when they do come into the hospital, as Michael mentioned, healthcare is in the future taking care of COVID patients as well as all other things that we have been doing. And we have pathways to keep those patients separated and all the precautions necessary to make sure that when folks come in for other related needs, that they are not exposed in separate areas, things along those lines.
Would you say that you're optimistic about where we stand right here, right now, today, as far as finally getting back to a more normal way of life?
I'm very optimistic. I think the key point that we keep hearing over and over again, the theme that people need to pay attention to is our own social responsibility. We have to manage what we're doing when we're out interacting in the community with others. We need to be self-aware from a standpoint of, if I'm not feeling well, one of the things that was always one of my favorite statistics, that not to be critical of school systems, but I always thought one of my favorite statistics was perfect attendance awards in the schools. So I always looked at that as, I know which parents made my kids sick when they came to school, because you're sick, go ahead, you need to go to school. That's not good for the rest of the kids. That's not good for. That's not good for interacting otherwise also. So it's important for us to be socially self-aware.
Yeah. Mr. Leonard, thoughts?
I agree. Whatever may happen or may not happen with COVID, we're happy, obviously, to see the volumes drop significantly over the last few weeks. And we're looking forward to getting back and engaging the community. And I think as a region, we're well positioned to do both. So very optimistic here.
PRMC President and CEO Steve Leonard, along with President and CEO of Atlantic General Hospital, Michael Franklin. Gentlemen, thank you so much for your time this afternoon.
Thank you, Jim.
So we appreciate it.